Good afternoon, everyone, and thank you for joining me today. I'm Jennie Montgomery. Welcome to another half hour of information to help you make the most of your time, to make informed decisions, and to keep up with goings-on around Greater Augusta. We have an important show today about domestic violence, and someone you will likely recognize is sharing her story a little later. But first, October is Breast Cancer Awareness Month, and by now we know the statistics. 1 in 8 women will get breast cancer. About 85% of breast cancers occur in women with no family history of the disease. A new breast cancer drug is showing some promise. Younger women suffering from a common form of advanced breast cancer have been helped when treated with a drug that targets cancer cells. A study was conducted with more than 600 women under age 59. They received a drug called ribociclib and a common form of hormone therapy. 70% of the women who took the therapy thrived after 42 months. I'm joined now by two folks who are dealing with breast cancer, one as a patient, one as a doctor. Courtney Johnson, thank you for being here, and Dr. Priyanka, absolutely, Dr. Priyanka Raval with the Medical College at Augusta University. You are the doctor, Courtney's doctor.
Thank you for having us.
Absolutely. Courtney is very young to have been diagnosed with breast cancer.
However, the fortunate part is that she found her lump herself very soon, and she decided to come to a doctor immediately. So that was really good that she came quickly to the doctor.
And Courtney, that is the perfect setup because you did find it. You had just had a baby.
Yes, ma'am.
And it was through nursing that you found it, right?
Yes. So when my milk came in, after about 3 days, the lumps were there, but I breastfed my daughter for a month, and then all of a sudden my milk supply dried up, and about 2 weeks had went by and the lumps were still there, and that's when I went to go get it checked out. But I didn't think it would be breast cancer. I thought it would be mastitis or something, considering I had just got done breastfeeding.
Yeah, and one of the things that must have made you feel like it's not going to be breast cancer is because there's no history of breast cancer in your family.
No, I'm the first one.
Gosh. So I think at your age, you're 32?
29.
Oh, wow, even younger than I remembered. 29.
Yes, ma'am.
And breast cancer.
Mm-hmm.
Wow. So I assume that you're having chemotherapy right now?
Yes, ma'am.
Okay. So tell me what your treatment involves.
As of right now, I'm going for 12 weeks. I'll be into week 3 tomorrow, and after that I'll be having surgery.
So, Dr. Raval, a lot of times the chemotherapy comes first to shrink the tumors, is that right?
Yes, that's correct. So this is a part of a multidisciplinary treatment approach, and we do something called neoadjuvant chemotherapy, which means the chemo precedes the cancer surgery, and it's done in patients in whom we believe they will benefit from seeing chemotherapy first. If the cancer tumor size is big or the tumor is aggressive, then doing systemic therapy prior to the surgery makes sense. It can benefit the patient from having less surgery in the future, or maybe decrease the amount of radiation they need or omit the radiation completely. So the goal is to get to have the cancer down to as much possible from the chemotherapy first, and then proceed to surgery.
You seem like you're being very brave through all of this.
Yes, ma'am.
And you're a young mother. I wonder if those babies make you stronger.
Oh, definitely. Because at the end of the day, I realize I have to be there for them. So I try to be as positive as I can be, just so I can still be around for my children, to watch them get old.
Absolutely. You are a beautiful young woman, and you have such a tremendous attitude. One thing that you really want other young women to recognize is the importance of getting a mammogram.
Yes, ma'am. Because I'm not 40, and so I realize that with this situation, anything can happen. So if they feel that there may be a lump there, or they just have some concerns, that they should definitely go get it tested.
The medical college is doing its part to make sure that happens, because we can't say this enough. Early detection saves lives. AU Health's Breast Health Center believes a weekend mammogram might be the answer for some women in their hectic schedules. So each Saturday in October, women can schedule a routine mammogram at the Breast Health Center between the hours of 8 a.m. and 1 p.m. You don't need a doctor's order, and most insurance companies cover 100%.
Women should start their screening mammograms by age 50, and if they have a higher risk of breast cancer, such as a known mutation associated with breast cancer, or if they have a family history, then they should start younger at age 40.
Don't you think that's what makes this so outstanding, that she didn't, she didn't have that. She didn't have a mother or an aunt or a grandmother saying, you have to, you could be susceptible, you've got to stay on top of this. I'm just so impressed that at your young age you were so proactive. One of the other things we want to mention real quickly before you all go is the walk that's coming up, the Unite Against All Cancers. Tell us a little bit about that.
Yeah, so it's our second year in a row that we are doing this, and the last year was very successful. It's Unite in the Fight. And it's for all cancers, in honor of any loved ones or patients that have gone through cancer, or in any way that it's touched their lives.
And you have all the different colors
That's
represented.
right.
You have the pinks and the teals and
Yes.
the golds and everything that represents a cancer.
Absolutely.
You wear your cancer color.
That's right. So you wear your cancer color, and uniteaugusta.com is the website if you want to pre-register and join this. It's on November 9th in the morning, and it's a 1.5 mile walk. Looking forward to it.
Certainly, certainly. So we come out of Breast Cancer Month, and then you'll get ready for the Unite in the Fight Against All Cancers walk. That's great. Dr. Ravel and Courtney, thank you all so much for your time today, and thank you for sharing your story. Good luck in your battle against breast cancer. I'm sure because of your positive attitude and your wonderful medical treatment, you're going to do very well.
Yes.
Thank you.
Thank you. Thank you for having us.
Certainly. Still ahead on Jennie, you've watched her on your TV screen for many years, but you may not know about the years she suffered in silence. News Channel 6's Dee Griffin shares her journey through domestic violence after the break.